South Africa is the most southern country in Africa, with a population of more than 53 million people. Besides HIV, tuberculosis, or TB, is a big health concern in this country. It is estimated that about 80% of the population in South Africa is infected with TB. Every year, almost 1% of the population in South Africa develops active TB. Each year, almost 100,000 people die because of active TB. 72,000 of them are HIV positive. This documentary was filmed in Polokwane Provincial Hospital. Polokwane is a city in Limpopo province in the northern South Africa. In this area, 17,000 people develop active TB each year. Almost 6,000 people die of TB in Limpopo every year, which is 12% of all the deaths in the province.
Okay, Sister Matrai Johanna. I work in Polokwane Provincial Hospital in medical ward.
Dr. Mate. I'm a medical officer in the Department of Internal Medicine, Polokwane Hospital.
I'm Marinelle Creer. I'm the infection control practitioner at Petersburg Hospital.
Okay, I'm Lydia Malova. I'm also an infection prevention and control practitioner here in Petersburg Hospital.
My name is Dr. Nakri and I am in charge of Wednesday Farm in Polokwane Medical Department.
All I know about tuberculosis is that it's a communicable disease that can be transmitted by drops, coughing. Those drops, they can be transmitted to another person. Management with regarding TB, I know just is it the first regimen? First regimen, not when it becomes the MDR and XDRs. There I cannot tell.
TB, of course, is quite common here in South Africa. From the moment you're born, it is said that you're exposed to TB, to a certain degree. So it's endemic in South Africa. It's very common.
We know quite a lot, I would say, because TB is not only primarily in the lungs. So many people has that idea that if you say TB, they'll tell you we are not coughing, but due to our experience and the years that we've been working with it, we've learned to see the other types of TB that we deal with, and in South Africa we deal quite a lot with extrapulmonary TB.
There are a lot of myths in our country in as far as tuberculosis is concerned. People think that when you have TB, you need specifically to cough, but now after we have been in the program for quite some time, we discovered that TB can be in the lungs and also extrapulmonary, which means out of the lungs.
TB is a very prevalent disease particularly in sub-Saharan Africa and of course in Asia and other poor countries. Before it was a disease of poverty, impoverished people living in crowded places, and they didn't have much medical help, so they were more prone to get TB, and they were quite the number of cases were quite high in Asian countries. And then the TB incidence started declining because of the treatment available. But for the past decade or so, the TB has started to rise again, and it is mainly due to the appearance of HIV infection.
First of all, the environment where we're keeping TB patients, the windows should be opened at all times, and then we should wear a mask. And we also encourage the patient to to block when they are coughing.
Yes, back in med school, we were taught to take precautionary measures when encountering patients with TB because TB is highly infectious. Like I said, TB can remain in the air. It is said that it can stay in the air for quite a number of hours. So if you're in a room where there's a patient with TB, they cough and leave the room and you come in, you can still get TB. There are other hospitals where I worked, there was a specific TB unit. There's a specific ward for TB patients. And with the way in which that ward is designed, it's not the same, it's not similar to what you see here. Because it has to be well ventilated. There are also certain lights that have to be in that ward which help to kill the germs. Right. So whenever you go to a TB ward, you'll see that there are always open windows and doors. It has to be well ventilated.
In each and every patient that is suspected as a TB case, because we don't have a TB ward specifically, we cohort those patients. So it means we put the 4 of them in one room. Each patient gets a mask until we can prove it's not TB. So you could let your gene expert and your AFB to ensure that it's not TB, and then the patient can be moved out to another. But the patients all get masks. So you give them a surgical mask, and once it's wet, you teach the patient how to tie it properly, and once it's wet, they discard and put a new one.
We teach them the cough etiquette together with their families. Cough etiquette simply means when they cough, they need to cover their mouths completely. After covering their mouths after coughing, then they need to go and wash their hands. And we teach them to not to spit on the surfaces like in the area where they are staying. And we also teach them that if there are people at home who are having the same symptoms, then they must send them to the nearest clinics if they can't bring them to the hospital. Teach them to open windows early in the morning when they wake up so that there is enough cross ventilation, that is, there is enough fresh air which comes into the house.
To tell the honest truth, no, I don't. I don't know, maybe it's because we think that we are protected since the windows are open, and we always encourage our patient to block whenever they cough. So I don't usually wear a mask when I'm a TB patient, but I know I'm supposed to.
If I have a mask, I wear it. I don't take chances.
We are supposed to.
Yeah, we are supposed to. When they call us, if the patient has been for quite a number of days on the treatment, we don't put on masks. But if the patient is very new, we do put on our respirators, our N95 masks. And at the same time, if the respirators are not on stock, what we do, we give the patient the surgical mask. Because the surgical mask, when the patient coughs, it has got larger pores which are going to trap the droplets which are coming from the patient's mouth. So usually that's what we do.
If I have to go very close to a patient and I suspect that this patient is open TB case, then I do use that special mask. I think they call it N95. It's a special, not ordinary mask. It's a special mask for protection against tuberculosis. So in this hospital, we've got all kinds of TB patients suffering from all forms of TB. And the reason being that most of the patients who've got TB have also got HIV infection. So they both come together, most of the cases.
Sometimes there is a shortage, and a serious shortage. We find that it is out of stock at our pharmacy. So we are forced not to wear the mask.
They are available, but you have to ask for them. You see, they are available. For example, here, if you ask the sister, she will phone and she will get it for you. So they are available, but As I said already, we are very casual about it, so we don't even bother to ask at times, most of the times. But they are available. The masks are available.
They should make sure, especially our ward, medical ward, it's where we admit TB patients. So they should make sure that at all times there are masks. Other things can be out of stock, but masks, they should make sure that we are always having them. Because there is no way there won't be a TB patient in our ward. No ways.
First of all, okay, in terms of precautionary measures, I believe that if ever you work in a medical department, you should be offered a face mask. You don't have to go and ask, beg. It has to be given to you because we know we work in a high-risk area, and people are exposed to these bugs almost every day. So it should be standard to say whoever works in the medical department should have an N95 mask. That should be standard. So at this point, because sometimes there are challenges, you find that maybe the masks are there, sometimes are not there. Yes, resource-related problems.
Yes, we do. With us, the N95 masks are kept by the infection control. So whenever there is a case in the ward, specifically our MDR cases, the multi-drug resistant tuberculosis cases, we will go and provide the ward with masks. And we also emphasize and make follow-ups 3 times a day, telling them only 2 nurses go in. They have to wear the masks. And please don't call all your friends to it, because nurses are funny things. They call their friends to come and see how an MDR looks, though you can't even see it, but that's human nature.
There is so much of TB that everybody knows, but there's always something you have to because it is too much. So people attitude is very casual about TB because it is there. And like here, there's so much TB, but as you have seen, that we're quite casual. We are not at times we are not taking proper precautions to prevent us to get TB. But there are measures which have been taken by the hospital. Firstly, we do not keep the patients here for very long time. That's one. Secondly, we sometimes isolate those patients and keep them in certain cubicles. We do not mix them with other patients. And then other patients who are very sick and elderly and they are not suffering from TB, we move them far from the people who have got TB, and we keep them in certain cubicles. There are masks available for the healthcare users and for for the general public if they have to go and see those patients. Sometimes, we don't ask, but they are there. Everything is available there to prevent people getting the TB.
The only way is via HIV testing. People should be educated, should be encouraged to practice safe sex. It's always TB, HIV, TB, HIV. So we should beat HIV, is then that we can beat TB. If it wasn't the fact that it is always related to HIV AIDS, it was going to be better if they do home visit and they test them. The incident of TB, it was going to be lower if it was done like that. But because it's HIV, it's a problem, a big problem. And people don't want to test. People don't want to test for HIV.
So from the patient side, I think it's about that health-seeking behavior. Be out there, look out what's happening in the media, and if you're sick, you shouldn't stay home for months and months before you get to hospital. So that's from the patient side. And from our side, it has to do with how well do we screen our patients for TB, right? And how quickly do we diagnose TB and hence henceforth, when do we start the treatment? The government should help in improving access to healthcare, of course, so that all the patients, especially patients in what we call level 1 hospitals, these are smaller hospitals and also clinics. They should be well equipped in terms of staff and also medication, because most of them, they actually get to see these patients before they even come into the hospital. So if something is missed down there, by the time the patient gets here, you have quite a baggage. So it makes things quite difficult.
Our former president Nelson Mandela always said we cannot do much about TB unless we do more about HIV. And that is unfortunately the reality that we have to face.
Since it's an airborne disease,
That's
you
the
know,
issue.
yeah, that's a big question to say, can we eliminate it because it's an airborne disease? As I said from the beginning, that most of us, we are infected, but we are not yet having the disease due to the fact that our immune system is able to protect us. The droplets, they are there in our lungs, but they are dormant. Only when the immune system has been compromised one way or the other, that the opportunistic disease called TB now will come into picture.
We must start treating the patients with HIV, and then we should take preventive measures for people not to get the tuberculosis. But the important thing is we should treat HIV and also isolate the patients with tuberculosis. We should have separate hospitals for tuberculosis, because there is a risk, if we take the infections lightly, you're going to get it. So that casual attitude should be discouraged.